Hey guys, this is Caleb Swartzendruber. Just making a little video for all you folks out there that are dealing with some low back pain. I'm just going to focus on low back for some of these videos, just for the fact that it's something that I've been going through basically my whole life. So, as a sports therapist, you'd think at some point I'd be able to get myself out of pain, and I do. I go through bouts of it where I'm better. But we'll get into that another time. So I just got back from the gym. Maybe I did something a little bit wrong. Maybe I rushed through, didn't take my form as serious as I should have. So I'm experiencing a little bit of low back pain on the left side of my sacroiliac joint. We'll call that L5-SI, where your fifth lumbar vertebrae and your sacroiliac joint meet. I'm feeling on the left side. I can kind of feel the pain radiating to the front. So I'm going to just show you a couple things that help me get out of pain. Maybe it'll help you. Okay, so this first thing, I've got a few basic tools here, we'll call them. This thing's called the Psoas. I just got it off Amazon. It's pretty basic. It does what we do as sports therapists, is releases the psoas from the anterior side. So I'm just going to show you how I use it. They have a little diagram on there how to use it too. And I'm basically just going to start low down my hips, and I just slowly work it up until I meet some resistance, which often just means I find a trigger point. We'll just call it a trigger point, where you feel a little bit of pain, and I'm just gonna, when I find the pain, I'm gonna take some deep breaths. And as I exhale, I'm gonna try to sink deeper into it and just slowly, and I'm gonna kind of rush through this, but I want you to know I probably spend a good 10-15 minutes just with this here, finding spots and then moving from side to side and just kind of opening up through your stomach and kind of working. Really what you're doing is you're opening up some of the fascia. So, and you find a spot, and it's not very pleasant, but it gets results. I found that it really does get results. So, okay, so 10-15 minutes goes by. You've opened up the psoas. What I like to do is throw a little bit of just the cat-cows in there to kind of mobilize the spine. And I'd say a good 10 of these is, and match it with your breath. On the inhale, it's what they call a cow. And then exhale, you're pushing your butt to the ceiling. And you're looking up with your eyes, okay? So 10 of these, all right, or more. Okay, and then now I just have a softball, baseball work, something this size. And now I'm going to start working the abductors of the hip. So, what I like to do is just find a nice, and this one is probably the most unpleasant. And again, what I'm doing is just slowly finding those trigger points that you know are there. And then when I find one, I breathe into it. Breathe in and sink it in. Let it slowly, we're all going to be a little worse than others. So some of you, you're just going to jump off the ball. It's going to be hard. So just, take your time. If you have to throw some heat on it first, maybe, another good way to if this is too much, is to activate it. So activating can simply just be here. Try not to flash the camera too much. What I like to do is keeping the knee locked in here. And really what we're doing is we're just forcing blood through those abductors of the hip. So I would like to say at least 5 minutes on each side, on each hip, just working through, releasing all, just take your time. Release these guys, okay? And then now you've released, 5-10 minutes has gone by, you've used your ball. All right, Last trick here from there. Again, I like to match it with the breath. So first, let's just start with one big deep breath into the stomach, pushing your stomach up. And then you're going to exhale, pulling your stomach down to the mat, down to the floor, and you're going to hold. And I'd say do 10 just big breaths, pulling that stomach down to the floor, and we're engaging what's called the corset muscle. Well, again, just doing very, very important muscle called the transverse abdominis, key in core health. So we're just kind of engaging that for 10. Okay, say now I've done 10 of these. Get yourself a basketball, a yoga block, really works the best. I don't have one with me here, but okay, now I'm gonna squeeze. I'm gonna breathe and squeeze on the way down. I'm engaging here and I'm engaging my adductors now. Okay, and let's do 10 of these. Okay, so now I've done my 10, and then we're gonna go breathe in, exhale, engaging, and we're gonna go 10 bridges. And the key with the bridges, we're really trying to focus on engaging our glutes. Okay? After these are done, we can throw some stretches in. You could do a lot more, but a couple quick stretches that you might do is just what they call pigeon in yoga. And then you can do a few of these. And then again, trying to keep your hips level. We're not here. I know my form is probably not perfect, but all right, a couple of these stretches, and then throw in a psoas stretch. Where again, your hips are in line. Engage that left glute. And even just demonstrating this video, my back pain it's gone at the moment. It's changed for sure. So we're doing some good. And I can't emphasize the importance of the belly breathing. All right? So there's number 2.